So hello everyone, a very good afternoon to all of you. I am Dr. Vinay Purohit. I'm a pharmaceutical physician and working as a DGM in medical department of Lupin Limited. It gives me immense pleasure to extend to you a very warm welcome on behalf of our entire Lupin team in this special webinar series on safe teleconsultation as well as medico-legal aspects. This is more relevant for gynecologists and obstetrician in this session. So we are privileged to have Dr. Nikhil Datar as an expert to take ahead the proceedings of this session. He's a senior obstetrician and gynecologist from Mumbai, and he's also a noted medico-legal expert as well as health rights activist. He has chaired in the past Medico-Legal Cell Association of Medical Consultants in India, and also he is a past national coordinator for Medico-Legal Cell FOXI. Although he doesn't need any introduction, but I would like to highlight that his role was instrumental in India for the government support also to draft this MTP law in our country. He has been also very active, and his achievements were shown in Satyamev Jayate program, where the national framework for rape survivor was framed with his all efforts. So with this, I would request Dr. Nikhil Datar to please take ahead the session, which is the first webinar on how to ensure safe telecommunication. Over to you, sir.
Good afternoon, friends. Thank you very much, Dr. Vinay, for kind words of introduction. I would want to share my screen. Let me just straight away go and share my screen with you all. Okay. So I suppose you all are able to see my screen. Can you all see my screen? Can Bhavna or somebody tell me?
Yes, it's visible, clear.
Okay. All right. So in about an hour's time, probably a little less than an hour's time, I'm going to deal with the telephonic or the email consultation, or we call it as teleconsultation. And I'm going to particularly concentrate on how do we make the teleconsultation medico-legally safe for all of us doctors who are going to use the teleconsultation format for helping our patients, for giving advices to them. One second. I think there is a little bit of a problem. My slides are not moving ahead. Give me a second. All right. So these few things, little bit of brief introduction. The reason why I'm here to talk to you is also because of the fact that I happen to have a degree of law. Although I do not technically practice law as such, but I am known as an activist. I use my knowledge of law to help my colleagues, my friends, etc., and also do some work related to women's rights and patients' rights, etc. So these are my contact details, my email address. If at all you have any difficulty at any point of time, feel free to connect with me, contact me, and I will try to help you level best. Now, first of all, before I begin, okay, I suppose there are approximately 200 people who are live logged in at this moment of time. I want to ask this question to all of you all, that how many of you feel unsafe or jittery while doing teleconsultation? If at all you feel so, then in your chat box, say why. That means yes. And if you do not feel so, then say no. Okay. So you all can do that exercise. Let's go ahead. And while you say this, okay, let me give you a background of why do we feel little unsafe or jittery when the issue comes up about teleconsultation. And the reason behind that is a number of these court cases. In 2018, there was a court case in Bombay High Court. Now, the facts are not only that the doctor advised on telephone, but there were multiple other facts. There was nobody there, no other doctor was not there, qualified staff was not there, doctor instructed to give some medicine, and ultimately the patient died. But in this particular case, Bombay High Court held the doctor criminally negligent. The word criminally negligent is absolutely important. Doctor was put behind bars, etc., for advising. Out of many things, one of the things was for advising on telephone. Similarly, there was another case. Jharkhand High Court gave this kind of a judgment. There was a case of pancreatitis. Patient came up which looked like an acidity. The doctor had not examined. So without examination, without diagnosis, a treatment was given and the person died because of pancreatitis. The Jharkhand High Court held the doctor responsible for not examining and telephonically advising medications. Karnataka High Court, similar type of a situation. There was a psychiatric patient with heart disease. Now, while talking on the telephone and receiving information on the telephone, the fact that the person had a heart disease was missed out completely. So obviously the psychiatrist had no understanding because he had not heard that particular sentence which said that the person had heart disease, and he gave a medication, Serenase was prescribed, and the person actually died because of heart attack. Even in the famous Supreme Court case, Martin D'Souza's case, the Supreme Court had said that it is advisable to avoid teleconsultations. So by far and large, the legal framework that whatever is available for us doctors to follow has always been against giving any kind of a telephonic consultation. But on the other hand, the fact of this is this, that teleconsultation was always in demand from the patients. Yeah. And how many of you all have had requests from the patients for their mobile numbers, for or how often do they send messages on WhatsApps, etc., etc. If at all you feel that that is very common, then type yes in the chat box. And it is so true that patients do want to have teleconsultation because they would want to avoid commuting to the hospital, sitting in the lines, etc., etc. It can be done at any point of time, so you don't need to wait till the OPD hours get started and all that. And third is that many of the times it gives a sense of happy feel to them because they feel that they can stay connected with the doctor, so that at any given moment of time they have any difficulty, then the doctor will be available for them. But on the other hand, if we look at it from the perspective of the doctors, then the difficulty that the doctors have is this, that it is a kind of a disturbance or a nuisance at all points of time because people just keep on asking questions at whatever odd hours that they want to ask. Obviously, it has a toll on the privacy of the doctor. Whether it is an illegal or an unethical thing to do has been always a question in our minds so far, and that's what we are going to talk about. The worst thing was that it really has some genuine limitations because you cannot really examine the patient, and we all have been taught basics, that is palpation, percussion, auscultation. Now all these three things cannot happen when you are doing a teleconsultation. So it kind of creates a very major setback to our basic fundamentals that have been taught to us way back in our MBBS days. And last and the most important thing is this, that this whole bothersome activity has been done completely free of cost. Nobody is paying us for answering on a WhatsApp or taking a phone call or replying on an email, etc. And there has always been a problem that on one hand you are advising them, but on the other hand nobody is interested in paying you. Now, my personal experience in my practice, and I'm sure many of you all will also agree to it, that it's very common that the person comes to you for the first consultation and then you advise for some investigations, etc. And when the question of showing investigations comes into picture, then they revert to these kinds of social networking platforms or emails, WhatsApps, etc., etc. And they expect you to look at their reports on WhatsApp and say yes, no, give them advice, discuss with them, and all that kind of thing. So I would consider roughly that close to about 20-25% of your OPD revenue is actually lost just because of the fact that you land up answering to their WhatsApp and emails and all that. And if you don't do it, then patients consider that this doctor doesn't seem to be patient friendly, and there's a possibility that they may be unhappy with you, they may change you, or whatever that they want to do, those things could happen. So up till now, the doctor was getting pulled from both sides, that if you do it, it's a problem. If you don't do it, again, it's a problem. And we were in flummox, as to what do we do really. Well, many of you all must be aware that there is a body called as Telemedicine Society of India, TSI, and this society has been working for a very long number of years. However, that question mark as to whether teleconsultation is legal or no was not answered till now. In the wake of the corona pandemic, this question suddenly was answered, and this question was suddenly answered, and this question was very, very, very rapidly and quickly answered by the Board of Governors. Now, you all should know that the Medical Council of India is currently suspended. So the job of the Medical Council of India is being done by this Board of Governors. So Board of Governors on 25th of March 2020, actually speaking, released a formal official guideline making teleconsultation perfectly legal entity in our country. So now you can be assured that teleconsultation has become legal entity subject to ifs and buts, and that's what we are going to talk about. And these guidelines have been made by the Board of Governance along with the Niti Aayog, and we all know how powerful the Niti Aayog is supposed to be in our country. So it is that powerful a body who has come up with these guidelines, and more so, these guidelines are now appendaged to the Code of Medical Ethics. So the law that we as doctors are supposed to follow, that is Code of Medical Ethics, now the teleconsultation guidelines become a part and parcel of this Code of Medical Ethics, which means that there's a solid reason to believe that teleconsultation is now absolutely legal and absolutely ethical to be done in our practice. So today I am going to talk about the guidelines, what the guidelines talk about. Then I'm going to talk about some limitations of these guidelines, some things which are kind of not really properly said or which probably they would want to revise or they should revise down the line. And then thirdly, and the last important part of my talk is going to be how you can safeguard yourself while doing teleconsultation. So my talk is going to be divided on these two major frameworks as in what I said. Now, these guidelines are supposed to be meant and supposed to be followed by all registered medical practitioners. So all of you all who have your MBBS qualification or your postgraduate qualification, all of you all who are registered with the State Medical Council are supposed to follow these guidelines. Second important thing is that these guidelines are applicable to any kind of telemedicine platform that is being used. So whether it is just voice consultation, that's a telephonic consultation, it could be text consultation, which could be messaging, which could be emails, it could be video consultation. So whatever the consultation may be, if it's not an in-person consultation, then any of those consultations and communications will be considered to be within the scope of these guidelines. And the third important thing is that what all things are excluded out of these guidelines. So the biggest thing is this, that this guideline is not meant for your consultations from the outside of India jurisdiction. So it means if a foreigner patient is wanting to consult, then these guidelines are not expected to be giving you any kind of a protection. Similarly, these guidelines are not meant for surgical or invasive procedures. So if somebody is going to tell you that I am going to operate at some place and can you guide me looking at my video, laparoscopy video online and all that, so those things are not possible to be done. Similarly, these guidelines are not supposed to be meant for research, for education, for CMV purposes. And it is but natural that these guidelines are primarily meant for doctors to practice, and hence it does not talk of the hardware requirement and the software requirement and the infrastructural requirement. Now, the commonest question that is asked to me is this, that is this teleconsultation going to be there only during the corona pandemic and later on it is going to be withdrawn? And ladies and gentlemen, answer is no. In fact, the registered medical practitioners are entitled to practice telemedicine and are encouraged to use the telemedicine in their routine practice. This is what this guideline says. As a matter of fact, down the line, the Board of Governors or MCI, whichever is the body that is going to be there, is going to make one kind of a course, and all registered medical practitioners who want to practice telemedicine should be or are going to be required to undertake this online course, and once they pass the online course, then they will be entitled to do the telemedicine practice. So this also means that if at all somebody says that I don't want to do teleconsultation, then it is perfectly fine. Nobody is going to say that you must do a teleconsultation. But down the line, there will be a course that will be developed. You will have to take the course, and only after passing that online course, you will be given a certificate that you are now free to go ahead and do the teleconsultation in our country. Now, at this point of time, there is no such kind of a course that is available. As you can understand that because of Corona, these guidelines were released very quick and fast. So that's why there is no course which is available at this juncture of time. The Telemedicine Society of India is working on this kind of a course there, although, but currently there is no course. And that's why in the interim period, it has been said that all registered medical practitioners in our country can go ahead and do their teleconsultation within the framework that is given by this guideline. Although since there is no course, there is no question of taking course. So just adhere to the principles that I'm going to talk about, and automatically your teleconsultation becomes medico-legally as well as ethically safe. Now, what kind of consultations or what types of consultations are possible or what are there? So one is, of course, depending on to the mode of communication, which I told you, it could be audio, it could be video, it could be chat, it could be emails, etc. Second is according to the timing of the information transfer, which means that if at all it's a chat, say WhatsApp chat, then it means that it's a real-time kind of a chat because you get a question, you answer the question immediately. Whereas if it's an email consultation, then it is going to be a staggered or a deferred kind of a consultation because somebody will send you an email and at some point of time later on you will be answering that email. Okay, so there could be a staggeredness or in terms of the timing or in terms of the information transfer. The third thing is that there it could be from the point of view of the purpose. So what could be the purpose? The teleconsultation could be for the purpose of giving health education. It could be for the purpose of counseling, or it could be for the purpose of making a diagnosis or giving treatment to the patient. Now, many of you would raise your eyebrows when I talk of treatment, but I'm going to come to that in terms of what kind of treatments are possible to be given on teleconsultation. Now, according to the nature of teleconsultation, again, your consultation could be divided into emergency consultation or a non-emergency consultation. Again, many of you all will raise your eyebrows when I say emergency consultation, but hold on, I'm going to come to that. And the non-emergency consultations can be further divided as a first consultation or a follow-up consultation. Now, I am going to come to this first consultation and follow-up consultation because it has much more importance than just the simple meaning or simple understanding. So I'm going to kind of clarify on this whole of these things. Now, these consultations again can be on the basis of who are the people who are on both sides. The most common consultation is going to be from patient to the registered medical practitioner and RMP back to the patient. This is what is the most common consultation. And today we are going to kind of really spend a lot of time talking about this particular aspect. But there could also be a consultation between a caregiver and an RMP, or there could be a consultation between an RMP and an RMP, which means typically let's say telepathology or teleradiology, or let's say a GP, okay, who takes an opinion of a neurologist, or a physician who takes an opinion of a neurologist. Okay, so in these kinds of situations, it will be RMP with RMP, and last is going to be the healthcare worker to the RMP. So which means that there could be your nurse, or it could be some associate doctor or somebody who is junior to you, and they probably could be taking this consultation. As in what I said, we are today primarily going to concentrate on patient to RMP consultation. Now, these consultations are supposed to have 7 key components, and I am going to explain to you about all these components as and how we proceed. So let us begin our journey on teleconsultation. Now, the first thing that is very important is that whenever somebody tells you that I want to do a teleconsultation, and when you start doing it, the registered medical practitioner is supposed to use his professional judgment or discretion while giving the teleconsultation. And at any point of time, if the registered medical practitioner feels that it is advisable to have an in-person consultation or a video consultation, then the registered medical practitioner should say that loud and clear and switch over or stop and tell the person to come for physical consultation. So for example, let us say that there is a patient who calls you saying that I have got chest pain. Now you are looking at this person for the first time. You have no clue why this chest pain is there. You think that there could be a problem. You think that it is absolutely important for you to put a stethoscope or put an ECG machine on the person. It is advisable that you clearly tell the patient that sorry, it is best that you immediately come to me, or immediately go to closest doctor and get this thing kind of consulted or checked up, because I cannot do this on teleconsultation. It seems to be unsafe and it is not in your interest. So this needs to be clearly communicated to the patient, because you are supposed to use your professional judgment whether to continue it or not. Now, second very important thing that the guidelines have talked about is that the registered medical practitioner must identify the name, age, address, email address, phone number, and most importantly, the registered ID of the patient. So you could consider something like Aadhaar card for that matter. So whenever you are doing a teleconsultation, it will be important that you kind of cross-check and cross-verify all these things which are being told by the patient, or if it's a video consultation, you can ask these questions to the patient. Similarly, the registered medical practitioner should also create a mechanism so that his credentials, qualifications, contact details, qualifications, registration number can be ascertained or can be verified by the patient. So basically, identification of both the parties is absolutely crucial, and one needs to do that. Now, if at all you are thinking that there's a doubtful situation, you are not looking at the video or the picture whether this person is a major person above 18 or no. If you are in doubt, then do not think twice before asking for the age proof. And if at all there is a person who is a minor person asking for a consultation, then there has to be an adult next to that minor person while you are doing the teleconsultation, and that adult person's identification again should be or can be confirmed and should be confirmed if you are dealing with minors. So in short, it is absolutely crucial that the patient's identification is very, very properly identified before we proceed with the teleconsultation. And similarly, whatever are the records that are getting generated, it's a good idea that the registered medical practitioner announces his name, his qualification, his registration number while he is doing the teleconsultation with the patients. I have already spoken about this, that there could be a number of ways of teleconsultation. It could be audio, video, etc. And the registered medical practitioner can again recommend an appropriate mode of consultation. So let's say that there is somebody who says that I have got some kind of redness in the eye. You can, and in fact you should, as a registered medical practitioner, tell the patient that, okay, you are on chat with me, better to switch on the video, let me see your eye, and only then I will like to carry further this consultation. So this again is a job of the registered medical practitioner to guide or navigate the consultation in such a manner that level-based ways and means can be used to reach a decent amount of, if not a final diagnosis, at least a working diagnosis or a provisional diagnosis is reached. Now, a very important question that is about the consent of the patient. Now here, it is very clearly said that if the patient is initiating the consultation, then it is considered that it's an implied consent. Now we must understand what is the meaning of implied consent. It means that by the actions of the person is showing that he is consenting to it. To give you an example, when a patient lies onto the examination bed, she's sitting in front of you, you say, okay, come on, get onto the examination couch, and the woman walks to the examination couch. It's an implied consent for the examination. The same is the story with the dental chair. So similarly, if there is a patient who is initiating the consultation, writing a mail or a message, then it is considered as an implied consent, and hence you do not have a problem. But if there is a caregiver of the patient or an RMP of the patient, and if he is initiating this consultation on behalf of the patient, then you require an explicit consent. Now, explicit means a specifically said yes consent from the patient. So let's say that there is a nurse who is going to somebody's house. There is a person who is, let's say, old age person, and he is at home, and the nurse is the caregiver, and there is some problem, and nurse is kind of contacting the doctor now. Now, in this kind of a situation, you will require the consent of the old man. And mind you, that this consent again need not necessarily be in writing. This consent can be even oral. This consent can even be on voice. This consent can even be of such sort that you are asking the question to the person that, okay, XYZ nurse has kind of come in contact with me. She wants me to consult. Are you okay? Do you want me to really give you opinion or talk to you? And let that person say yes, and then you can go ahead and take it from there forward. And it is very important that the registered medical practitioner records the consent in his records, that if there was a consent which was specifically obtained, or how was it obtained, was it implied or was it explicit. And of course, after that, there will be an exchange of information. That means the patient will talk whatever she wants to or he wants to tell you. The RMP will stop. RMP may ask questions, may seek more information. RMP may also pause the consultation and say that, okay, first of all, let us get few investigations done and then resume back the consultation. So many such kind of exchanges may occur in terms of the information between the RMP and the patient in terms of reports, investigations, other records of other doctors, examination findings of other doctors, more symptoms, more details, and all those kinds of things one can definitely ask for. And once this is being done, if at all suppose the registered medical practitioner feels that it is advisable that the person goes through an in-person examination, then one should advise that. Or the registered medical practitioner can say that, okay, you go to XYZ doctor close to you and get yourself examined, and then again connect back with me with his examination findings. Okay, so that's also one more thing that is doable and that is possible. So to give you an example, let us say that I have somebody who is discussing with me about, say, fibroid uterus, or let's say with prolapse uterus. Okay, and obviously it's not possible. The person is not in Mumbai, cannot come to Mumbai to take my consultation. I could say that, okay, go to a next door gynecologist, get yourself examined, let her findings be there, and share those findings with me. And then I will discuss with you the options of treatment, whether to do surgery, the pluses and the minuses, and what are the choices, and all those kinds of things. So that is definitely doable, and that is definitely possible. Now, before I proceed ahead, can somebody, Gaurav or Bhavna, give me a signal that am I going well? Am I audible? Am I clear?
Yes, sir, it is perfectly fine.
Yes, sir. Perfect.
Thank you. Thank you. Now, let me come to the next very critical issue, and that is what is exactly defined as the first consultation. Now, obviously, everybody knows that first consultation is the first consultation at which time you meet the doctor. Now, if this patient has met you before, but met you more than 6 months back, then this consultation again is called as a first consultation. And similarly, if this person has come to you within 6 months, but primarily speaking has come to you with a different health condition. So to give you an example, let us say that last time somebody came and asked a doctor a question or consulted for hernia, and now he is asking for something else, say pain in the leg or something of that sort. It's a different health condition, and hence it again has to be called as a first consultation. And these definitions are very vital because the scope of this consultation is going to be discussed further. So you need to understand the importance of this definition of first consultation, as well as the follow-up consultation. Now, what is meant by follow-up consultation? Follow-up consultation is that you have done your first consultation and within 6 months you are coming, or you are coming within 6 months and coming for the same problem, or if your first consultation was in person and now this is the second consultation, then that is called as a follow-up consultation. Now, there may be a genuine situation that the registered medical practitioner may not be able to recall what kind of discussion he had or she had with the patient. If that is the case, if the registered medical practitioner cannot put the patient in that perspective, then it is to be considered as a first consultation and it is not to be considered as a follow-up. And this can happen very, very frequently because our patients are very, very categoric in this sense. It's very common that they will, really call you a pechan kon type of a story. Pechana, and you had given me this medicine, and medicines are not in front of you, and the papers are missing, and they expect the doctor to, from their brilliant memory, suddenly think of some lady called Mamta who has come 4 months back to you and all that. So in such kinds of situations, don't get pressurized unnecessarily. You have to simply say that it's to be treated like a first consultation, and don't shy away asking the information and going ahead like a first consultation when you deal with these patients. Now, I told you that emergency consultation can also be done online, and I again said that many of you might raise your eyebrows, and that's why here are the details of that. So if it's a first consultation with a registered medical practitioner, then the follow-up consultation has to be with the same RMP. I mean, if the RMP is changed, then it again becomes a first consultation. Now, emergency consultation may happen for a number of reasons, but primarily speaking, when it is an emergency consultation, the role of the emergency consultation should be only restricted to giving life-saving measures or first aid measures, and you should very, very categorically say to rush to the hospital nearest. You might be able to help the patient suggesting few nearby hospitals, not one nearby hospital, but probably few nearby hospitals or few nearby doctors, because it's an emergency. But in an emergency, the role of the consultation is only to give first aid and direct the patient to the closest hospital, but there is no further role in an emergency consultation. So it's not a consultation per se. It's like absolutely an immediate help that you are going to give as a Samaritan person, as a person with good intention to help. That is what it primarily speaking means. Now, as and what I said earlier on, that these consultations could be used for health education purpose, they could be used for the purpose of counseling, and they could also be used for the purpose of prescription. And I'm going to talk about the prescription part of it. Now, first and foremost, it is very crucial that the professional accountability of the registered medical practitioner will remain the same when it comes to prescribing, whether you are prescribing in person or whether you are prescribing online. So you are responsible for the prescription that you are going to write. And hence, it is very crucial and vital that the registered medical practitioner must use his discretion before prescribing. Second important thing is that before prescribing, you must come to, if not the final conclusion or the diagnosis, then at least a provisional diagnosis. If you have not come to any kind of a provisional diagnosis and still go ahead and prescribe, then it will be called as a professional misconduct. So it's very crucial to come to some conclusion, though not the final one, at least provisional one, before you go ahead. Now, there are significant amount of restrictions on giving prescriptions. Now, you can't prescribe anything and everything under the sun. As a matter of fact, there are lists that are created, and the last list, that is the prohibited list, which is the list of Schedule X drugs or the narcotic and the psychotropic drugs, which you are expected not to prescribe as far as teleconsultation is concerned. So now this means, by these guidelines, all our psychiatrist friends are going to be out of job for as far as the teleconsultation is concerned, because obviously they are most likely to use the narcotic and the psychotropic drugs. So there is a lot of work that probably the psychiatry associations need to do with the Medical Council of India or with the government, so that some kind of via media can be found out, and they also could be able to avail the teleconsultation facilities for their patients, of course with given limitations, but that's what is likely to be the case. Primarily speaking, there is a very restricted scope for prescriptions that one can give on teleconsultation. Now there is list O, which are basically OTC products. Now we as gynecologists are going to be very happy, because most of our products, iron, calcium, vitamin, paracetamol, ORS, etc., most of them are OTC products. So more or less we are quite okay in these kinds of situations. If at all it's a declared public health emergency, let's say there's a district in which the government has declared it as a district related to malaria, okay, then you are fine to give anti-malarial on e-prescription, but otherwise you are not allowed to give such kind of medicines, those which are not OTC. In short, if you are talking of OTC products, then you can absolutely feel free in prescribing. There is absolutely no difficulty. You can definitely go ahead and prescribe. Now comes the second list, that is list A. Now list A are those medicines which are basically not OTC medicines, but they have a very low potential of abuse. Okay, so what it means is, let's say there's antibiotic eye drops or antibiotic ointments. You can prescribe them on telemedicine, but mind you, you are supposed to prescribe these medicines only after video consultation. So it means if my skin specialist friend, if there is somebody who says that, okay, I've got a rash, then the skin specialist should say, first come on video, let me see the rash, and then he will or she will prescribe an ointment, or maybe ophthalmologist can do so for eye drops. So that is possible to be done. So these are the medicines that come in list A. And then comes the list B medicines. Now here it is very important to understand when do you prescribe list B medicines, because list B medicines are little different medicines. They could be antihypertensive medicines, they could be refill medicines for that matter. And they are not necessarily OTC products, and they may have a significant amount of potential also, but they are still within the list B. And that is why when you are prescribing list B, the condition or the precondition is that you have to have the first consultation, which is an in-person consultation. In short, let us say that there is somebody who came to me 3 months back for hypertension to my clinic. I have examined the patient, I have given certain medications, and now the person is reporting to me 3 months later that, okay, my blood pressure is still not staying under control. I have checked it with my GP, my blood pressure remains high, and I'm asking for another medications or a change in the medication or the dose of medication or a new medication, which is an antihypertensive. In those cases only, the list B medicines or such kind of medicines can be prescribed. So unless at least one consultation has been in-person consultation, and again, it means that it has to be for the same reason, it means that it has to be within 6 months, and it has to be first consultation, which is in-person consultation, only then the list B medicines can be prescribed. Otherwise, you cannot prescribe the list B medicine. So in short, the amount of medicines that you could prescribe on teleconsultation is super restricted. So one does not require to get worried about the prescription part of it. Now, these prescriptions again have to be in the standard format. And at the end of my presentation, I am going to tell you about what do you mean by the standard format of prescription once again. Of course, this has been told by the Medical Council in the past as well, but I'm going to reiterate that. And of course, then one could write this prescription and take a picture of it and send a picture on WhatsApp or in a message form or JPEG form or whatever you want to do. Now, if at all you are using any kind of a software for it, then you could also give e-prescription in a particular format based on the platform that you are using. Or let's say you are working in a hospital who have a dedicated system created for e-consultation, then the prescription could go into that format. Now, mind you, there is one very important thing. Many a times it so happens that the system is made in such a manner that the prescription goes only to a specific pharmacy of your hospital. It doesn't go anywhere else. Now, this is not supposed to be allowed unless and until there is an express consent from the patient. So it means that you need to ask the patient that this is what I'm going to write for you. Can I send this prescription to my pharmacy? If the patient says yes, only then you say it. If the patient says that no, I don't want to come to your pharmacy, then you will have to write an open-ended prescription the way you will write on a letterhead and take a picture of it and send it. Or we could send it on in your format, whichever the format may be, but that has to go to the patient's email then in that case, not go to the pharmacy. Basically, you cannot do a restrictive practice. You cannot kind of, only direct patients to a particular pharmacy, not by their choice, but because of your choice or because of your hospital's choice. So this is a format that has been shared by the guideline. So as you can see that this is going to be the registered medical practitioner's name, the qualification, the number, the address, the contact details, date of consultation, name of consultation, the address, the age and the gender, height, weight as given by the patient or not applicable, last menstrual period. Then it will be a typical chief complaints and the onset, progression, duration, etc. That is what we always do. We have been taught. examination and the lab investigations. Now here, as you can understand, examination could be video examination if it is mainly to do with skin or eye or something of that sort, or it could be examination done by some other physician or by some other practitioner. Lab investigation, if you have suggested an investigation, then those investigations one could have. Then diagnosis or provisional diagnosis, absolutely crucial. I have spoken about this. And then comes your prescription, and then you will write this prescription. If there are any special instructions, then you will mention the special instructions, and at the end of it will be your signature. It will be, which also will bear your stamp, and the stamp also must contain once again your registration number. Now, lots of people have this question that if I'm using a format or if I'm using a platform, because you will have to use a platform, let's say WhatsApp for that matter, and let's say if there is a breach of confidentiality at the level of WhatsApp, who will be held responsible? So this guideline has given a lot of immunity to us, that the registered medical practitioners will not be held responsible for the breach of confidentiality if there is a reasonable evidence to believe that the patient's privacy and confidentiality has not been compromised by the RMP, but has been primarily compromised by the technology aspect of it, and not by the registered medical practitioner or the person who was working under the registered medical practitioner. So there is a lot of safety that has been provided by this guideline. Now you need to mention the telemedicine consultation that you have. By record, I do not mean audio record or video recorded. Record means you need to write it down or log it, that so and so patient at such and such point of time. Okay, so as and what I said, that we would kind of log onto these consultations. Okay, we don't need to mean by record as in record in that sense. That's not what is expected. I mean, of course, nobody stops you from recording it if at all you wish to and want to. It's always safer to do so, but guidelines don't expect you to record. Then all the records, reports, documents, images, diagnostics, whatever have been done, whatever have been shared, again needs to be retained by the registered medical practitioner. Now, this is very crucial and this is very important. Similarly, the prescriptions also need to be recorded and kept with the registered medical practitioner. So it means that the whole responsibility of maintenance of records lies with the registered medical practitioner. Now, the catch over here is this, that if you read the Code of Medical Ethics, then Code of Medical Ethics says that you need to maintain your records for 3 years, but this is applicable to your indoor records. But there is no mention of your OPD records. So the point that I want to make you understand is this, that in normal course of events, when it in-person consultation, the Code of Medical Ethics does not say anything about maintenance of records when it comes to OPD. But here, even if it's an OPD, you need to maintain the records. So that's a very important point that you all should remember. I will not go into this. Now comes a very important question, that can you charge for teleconsultation? Of course, yes, you can charge for the teleconsultation, and you can charge as much as you want for the teleconsultation. So I have given you this particular exact sentence from the guideline, that you can definitely charge for the fees, and you can charge the fee even in advance for the teleconsultation. You can give a receipt, you can give invoice. There is absolutely no difficulty. It's a perfectly legitimate way of doing things. Now let's come to misconduct by the registered medical practitioner. So even if you are doing a teleconsultation, conduct and ethics, whatever that has been told to us, general requirements wise, all need to be followed. Regarding to compromise of patient care, privacy, confidentiality, violation of any prevailing laws, obviously will be a misconduct. These are few of the examples. Now this is again very important, that RMP is insisting on telemedicine when the patient is willing to travel to the facility. Okay, patient wants to come, RMP saying no need to come, do teleconsultation, will be considered as a misconduct. Or let's say sharing the patient's images, data, etc., which are particularly private in nature, will be considered as a misconduct. Writing medications which are not supposed to be from the specified lists that is, it's a category list O X kind of category, and you are writing it, will be considered as misconduct. Soliciting patients or using this platform for advertisements or inducement again will be considered as a misconduct. So these are few things which are going to be considered as misconduct, and the penalties are going to be same, exactly the same as that of the Medical Council Act or the Code of Medical Ethics Act. Now the twist to the whole thing came up when this letter was shot by the Indian Medical Association headquarters, whereby they basically said that, well, we understand that currently it's a COVID problem, and that's why you have kind of come up with this. But there are a lot of fallacies, a lot of problems, and that's why, there is a sense of caution that needs to be kind of followed, and just don't simply go gung-ho on telemedicine and teleconsultation. And that's what typically was a letter which was signed, and that's why it just kind of brought a little bit of a twist and a turn in the whole situation. So they are not wrong. I mean, there are certain limitations when it comes to when you are kind of dealing with patients. But yes, in the current situation and even later on, patients will demand for it, and now it is legal, and one can go ahead and give them the required consultation on phone or teleconsultation, because it is allowed by the Niti Aayog and because it's a part of Code of Medical Ethics. So even if the IMA says so, one should take that point, and one should understand the gist of that letter and put such kind of systems in place so that your teleconsultation becomes perfectly medico-legally safe. And that's why this part of the talk is now going to talk on how do you make your teleconsultation safe. Now, you could do teleconsultation in one of the two ways. One is where you are not using any dedicated platform. You are not using any specific platform, app. Nowadays, a lot of people are coming up with these apps, etc. So one is that you're not using any of the apps. And then how do you safeguard and how do you actually do a teleconsultation? And second is that these are some things that I would like to say about how do you choose or find out which is the app which is good for you. So that's why I'm going to comment a little bit on both of these. Now, let me tell you that these are my recommendations. I have finished talking about the guidelines. Now I am giving my recommendations to you. These are all personal recommendations. These have got nothing to do with anybody, but these are the recommendations which I feel that can provide a lot of medical legal safety to all those people who are doing the consultation. Give me a second, I just have water. Okay. Now, my first recommendation will be that anybody who gives you a call or wants to chat with you on WhatsApp, tell them that at such and such time, let us do a video call. Why do I say so? The reason is that it brings a sense of sanctity, a sense of seriousness. It's not like a communication between two friends or two pals or something of that sort. So that's why you say that let us do a video consultation, because there are a lot of things that you can even check on the face of the person, and even the physical appearance also can tell you a lot of things about the patient, and you will all agree with me as good clinicians, this is what has been taught to us. I mean, we all hear about these stories that how a senior teacher or a medical teacher sitting could diagnose a case of ruptured appendix on the basis of the way the person could walk inside the cabin. We have all heard of those stories, and we also kind of believe in those kinds of things. So it's always a good idea to do a video consultation. That is point number one. Second important thing is this, that you should ask about the information, about the personal details, complaints, etc. Now, on the consultation also, you can once again say that, okay, tell me your name, tell me your age, tell me your Aadhaar card number, tell me all those kinds of things you can do. Number three, that it is always a good idea on a video consultation to say that, well, you have approached me for the teleconsultation, and are you okay to discuss your problem? So patient says yes, and all this is kind of getting, if at all patient is recording this anywhere, then again, it becomes an explicit consent. It becomes a consent which is coming from the patient side. So automatically that is another thing that can be done. Last important thing, that while you are talking, you can again say that I am Dr. XYZ having XYZ qualifications. This is my registration number. So even with that kind of a thing also can be done. So basically what I mean to say is this, that it gives a sense of a systematized, serious conversation. it doesn't remain a conversation which is just like, ऐसा ही उसको भेज दिया, उसने हाँ बोला ना बोला, that kind of a thing. It brings a sense of seriousness to the job that you are doing. Patients also consider it to be little more serious kind of a stuff. Because it's a serious stuff, naturally when you ask for the money, the patient will also pay the money for it, because it's not like one sentence or one word yes or no kind of an answer. So it's like more serious. You are putting some amount of time, energy, effort. It looks very serious and systematized and formal. Patients will be happy to pay you for it. Once your consultation is done, you should record all your findings. So basically what you need to do is this, that you need to take your letterhead or your case paper in front of you, the way you do otherwise in your open consultation or your physical consultation, and the way you take the history and go on writing your history and all that kind of thing, more or less the same kind of thing you can do over here also. The only thing is that on the top of it, that letterhead, you should write about the type of consultation, that you should say that it's an online consultation, date and time, and whether it was a WhatsApp call or it was Zoom call or whatever call it may be, you could record over there. Okay. And whatever is the case paper that has been made, you should definitely share that case paper, but never share that case paper in a Word format. You either take a picture of it and send it, or save it as a PDF format and send it on your, and use a letterhead obviously. Because of using the letterhead, automatically your name, registration number, qualification goes to the patient. So more or less what happens is this, that it becomes a clear-cut, straightforward kind of a thing. Now, I would recommend that you should send a self-declaration form to a patient. So let's say I get a telephone call from somebody saying that I have got XYZ problem, I want to consult you. Can I talk to you right now? I would say, okay, we need a video consultation for this. 6 o'clock in the evening, please call me from such and such number. We will do a video call. And before that, please fill up this form. I'm sending this form to you. Please fill up this form at your end and send a copy of that form to me, either by email, or you could also click a picture and send it to me. Now, this is a self-declaration form in which the patient himself or herself is writing the information. So naturally what happens is this, that this becomes a kind of a story that is given to you by the patient. So it's the patient self-declaration form. So automatically it not only provides you with the information, but it also provides you with the medical legal safety that this information came from the patient side. And all these things one could record as far as your consultation is concerned. Similarly, okay, I would, I think, recommend all of you all to take a picture or a screenshot of this slide, because this is going to be very crucial and very important. Now let me go to the next slide, which is again something which you must take a screenshot of, and this is the model consent form. Now I have already told you that when a patient is approaching you, okay, even the patient's consent will be considered an implied consent. You do not require a specific consent. However, it is always a good idea to take an explicit consent. Nobody has told you that by taking an explicit consent, you will be held guilty or wrongful. So you can definitely go ahead and take a explicit consent. So what you could do is this, that somebody calls you, you can say that I'm sending you 2 forms. First form is self-declaration form, so please fill it up and send a picture of that. Second is the consent form. Again, fill it up and take a photograph and send it by after signing, obviously. Okay, which means that you have got a lot of medical legal safety that is involved. And in this consultation format, I have mentioned it already, as you can see it over here, that you are saying that here is the patient who says that I seek Dr. XYZ's online consultation. I am aware that the teleconsultation has a number of limitations as compared to personal consultation. Personal consultation is always better and more accurate. However, since I cannot go to the consultation room, that's why I am seeking for online consultation. So this automatically solves a lot of your problems. All that soliciting to come and not come and all those things taken care of. I am aware that Dr. XYZ is an RMP having ABC qualification, is registered with XYZ State Medical Council at number XYZ. So that means your declaration of your qualification, that chapter, that responsibility is over from your side. During the consultation, I will get to talk to the doctor, but no physical examination is going to be possible. And that's why at any point of time, if the doctor feels that physical consultation is needed, then the doctor may immediately indicate that. And because of that, automatically it means that the teleconsultation would not become complete. You can also indicate the professional fees, and you can also indicate and insist that the fees should be paid beforehand, and only then the consultation can be started. Then I understand that a doctor can prescribe only those medicines that are allowed to be prescribed during teleconsultation, and this prescription will come in a e-format. So again, that is another thing. And lastly, I state MNP, whatever, Aadhaar card number, whatever, I am so and so, and I am consulting with my free mind and entirely at my will for consultation. And below that, patient can put his signature. So more or less, this becomes a foolproof consultation consent format that's going to be there. Then, as and what I said, that you could just simply use your own letterhead the way you would otherwise do for your any other patient, and start taking down all these notes. Begins with type and the detail of the online consultation, personal information including the ID, Aadhaar number. You can write complaint, onset, duration, progress, examination, investigation, suggested investigation, diagnosis, whether final or provisional, special instructions, prescription, and lastly the signature and the identification. So you will stamp and your signature is going to be there. So this should be your case format that you should use. Now this is a kind of a slide which basically tells you about the prescription and what all things need to be there. So doctor's name, doctor's qualification, the registration number, doctor's address, doctor's clinic address number, email address, date. These are the things from the doctor's side. Patient's name, patient's address, age, sex, weight if possible, or weight which is disclosed by the patient. And then lastly, the name of the medicine. Preferably it should be in the bold as and what the medical council has indicated. It should be generic name. You may want to write a brand name if you wish to. Strength, dose instructions, duration, and the total quantity of the medications. And lastly comes the doctor's signature and the date and the stamp of that doctor. So these are few requisites for any prescription, whether it is physical prescription or online prescription. Now, lastly, I'm going to talk to you about 15 things that an ideal online consultant, if I'm sure many of you all must have many people must have approached you that we have this platform, why don't you use it? We will charge this amount, that amount, etc. So here are those 15 things that you should look into any platform before signing up with them for the teleconsultation. The first, this platform should work on Android phone, iPhone, as well as it should be web-based. Number one. The data should be doubly encrypted end-to-end so that there is no possibility of any leakage. No other person except the doctor or the patient should be able to see this data. If there is a person who can decode it, and I will tell you that even with banks, when we do these transactions online, there is some person who can do decoding of this data, but the system only is of such sort that there is somebody who can decode it, but that person must have a non-disclosure agreement which is signed with the company. Okay, that's very crucial. Even banks also have this system. There is no alternative to that. Then the company should secure the data sufficiently and indemnify the doctor for the loss of the data. So company should say that we will take the responsibility of this data, and loss of that we will not hold the doctor responsible. Platform should confirm the identity of both doctor as well as the patients. That is very straightforward. Recording, if it is possible, then that's very good. Audio, video recording should be great. Audio, video, chat, all formats one should be able to do through that platform, and the patients also should be able to send their reports through this platform. There should be sufficient amount of space for data storage. Platform should not solicit any patients. There should be a disclaimer for all patients, which is like typically how we do it. We go onto a website, it says that by clicking, you are accepting XYZ kind of a thing. So that kind of a thing can be created by the platform. The consent for every specific consultation with a specific doctor should be recorded by the platform. So it's not like a general consent that I can consult any doctor on your platform, not like that. Before your consultation with your patient, there should be a specific consent as regards you and the patient. That specific consent should be there. The delivery of standard prescription format is obvious. I mean, that's what you require to do. And lastly, direct linkage with the payment gateway. So these are those 15 things that one should be able to have if you are signing up with any of those platforms. I think this is my last slide. The guidelines that I spoke to you about are all available online. Bhavana, we are now ready for the questions. I'm on. This is my last slide. So this is the link. It's a free link. You can just type this link in Google, and you will get a downloadable telemedicine guideline that is there. You can once again go through this guideline, and you can recheck whatever I have spoken about and try to implement all of those things in your practice. At the end, let me once again thank everybody, particularly Lupin, for giving me this benefit, giving me this chance to talk to all of you all of my colleagues across the country and shed some light about telemedicine, teleconsultation, and more particularly so about the safety of that. How much time do we have? Can the organizers tell me?
So we have enough time. You can continue.
Oh, all right. So now we are going to take few questions. Description as per the format you have shown, you can upload the picture of your normal. Yeah. Okay. So basically what I've shown you is that any prescription, whether it is E or otherwise, has to have all these things on your prescription. Now, you can write that prescription, you can take a photograph of that prescription and send it. That's perfectly all right. But the point is that every prescription must have all those things which I showed you just now, whether it's pen and paper letterhead prescription or online prescription. Okay, all those things have to be there as a part and parcel of any prescription. Dr. Poonam Gupta has asked me that can hormonal medicines, for example, for PCOS, metformin, prescribed on teleconsultation for the first time? It's a brilliant question, and this is a very common question. In fact, most of the people ask this question about antibiotics as well as about hormones. Dr. Ashwini Bhadarao Gandhi, hello madam, she has also asked the same question. Now, at this point of time, if you see the teleconsultation guidelines of that I spoke about, there is no mention about antibiotics in particular, except antibiotics which are in the topical format, which is the list A which I spoke to you about. But besides that, there is no mention of any antibiotics in particular or hormones in particular. However, if you see the gist of the matter, then they have said that OTC products can be prescribed. Okay, now that is list O. So any medicines which come as a part of OTC can definitely be prescribed. There is absolutely no problem. Metformin is an anti-diabetic medication. Primarily, we of course use it for PCOS. The guideline has mentioned about metformin for the use of diabetes. In fact, they have given that as an example. But as and what I told you, the first consultation has to be in-person consultation. So here I would answer the question to Dr. Poonam Gupta particularly, that if her first consultation was a physical consultation, and then if at all she's prescribing metformin online, then it is all right to do so. But if at all for the first time she is seeing the patient online, then I would consider at this point of time to refrain from giving prescription of metformin. Okay, so in short and substance, metformin can be given, but metformin will be given only if at all it's a follow-up consultation, whereby the first consultation is in-person consultation. Oral antibiotics, injectable antibiotics, particularly oral antibiotics, no mention of it, and that's why, and they are not OTC products primarily, so I would say no to antibiotics. Now, if you are prescribing any injectable medications for that matter, first, injectable medications cannot be prescribed to the patient directly. But if injectable medications are being prescribed from the doctor to another RMP, from one RMP to another RMP, or from one RMP to another healthcare worker, let's say there's a qualified GNM nurse, then one can prescribe injectable medicine, provided that injectable medicine has been taken before by the patient. For example, there is a person who is on insulin or on low molecular weight heparin, for example. Now you are being contacted by, say, a nurse who is taking care of the patient. The nurse says that her sugars are 400. She's already on insulin. So matter is only to adjust the dose of insulin. So the doctor is telling the nurse to change the dose or administer the new dose of insulin to the nurse, provided that that person is already taking insulin. Otherwise, the answer is no. Okay. Okay. So I think the list that I have got so far from Bhavna, I think more or less. Are there any other questions that I need to deal with?
6, 7 more questions are there. Like almost, you can see some questions, and I have to put more questions. 7, 6, 7 questions.
Okay, so I can only see the questions that I have answered so far. So maybe you can ask me those questions if you don't want to send it across to me. Okay. Has come forward is this, that are these telemedicine guidelines going to be the same? No, the answer is that they have clarified it, that currently they have quickly released these preliminarily guidelines. These guidelines could get changed down the line. As a matter of fact, the things that would really get changed is the list of medications, because the Board of Governors has the capacity to expand the list. So that list O, list A, all those things that I spoke about, those lists are likely to get expanded down the line. So one may have a little bit of a scope, for more prescriptions probably, that one can probably be able to give. But as of now, this is what it is. Okay. So that was one more question that came up. Are there any other questions? Bhavna, can you tell me if there are any other questions?
Yes, sir, there are questions.
No, we are done. We are done. Please check. We are done.
Okay. Anyways, if at all, suppose you have any other questions later on, feel free to write to me in the chat box. I am giving you my email address as well as my mobile number. If at all you have any problems, you can connect with me. I'm always happy to help you. Mind you that I do not do like a legal practice per se, that I do not go to the court of law. I'm a practicing obstetrician and a gynecologist in Mumbai city, particularly in western suburbs. But feel free to connect with me if there are any questions. I'll be happy to help you dealing with these questions. Okay, so I think we are almost done with our question answers as well. So I would want to end the seminar once again by thanking all of you all, particularly thanking Lupin for helping me, Dr. Vinay for the introduction, Abhishek Lamba from Lupin, Mr. Ashish Singh from Lupin, Bhavna and Apurva, who have helped me at the moment of time to deal with these situations, particularly a little bit of a hang up that we had because of the technological issues. And I am told and I am overwhelmed because I have got a message saying that at this point of time there are more than 400 people who are attending this seminar. So I would seriously want all of you all to give me a critical feedback on my email or on my mobile number. You can give it as to how did you like the seminar and what more can be done in terms of making it very interesting. Over to you, Dr. Vinay.
Yeah, sir,
my
we are really
actually,
grateful.
I'm so sorry, guys.
Yeah,
I just got so many questions. I guess 10 more questions I just got.
Okay.
So can I send all those questions to you, sir?
If you have time, go ahead. You can ask me the
Yeah,
questions.
we have time, sir. We have time. Yeah.
तो आप मुझे पूछते जाइए, मैं बताते जाता हूँ.
I hope they are not repeat and we can ask few more questions. Bhavna, please go ahead. Meanwhile, I will also would like to remind our viewers that we look forward to the second session with Dr. Nikhil on other medico-legal aspects of practice, especially the gynae practice. And this session would be conducted on 8th May, the same time. And it was quite informative and important session. And I feel that it was actually the need of the hour, because during these changing times, I'm sure these doctors, all the viewers, they must have gathered many insights, and which will be immediately used in their practice now when the lockdown is being lifted gradually.
Okay. Okay. So, Dr. Poonam Gupta has asked, it is not possible to do obstetric examination on teleconsultation. How do you make yourself medico-legally safe in investigation and USU? Yeah, you are absolutely right. I mean, there is absolutely no question that you at no point of time can compare a physical examination with a teleconsultation. And that's precisely when your disclaimer in the consent comes into the picture, that you are specifically saying that the best way will be to come for a physical consultation, but otherwise there is a limitation to it. So at a given stage, it is always advisable to call them for a physical consultation, because on online consultation, you can only ask for the fetal movements, for swelling, if they could have checked their blood pressure at home, weight at home, or something of that sort. So you are completely right. I mean, there is no doubt about that part of the story. I will tell you what I do. I use teleconsultation primarily for discussions, for counseling, for a follow-up as regards reports are concerned, for the purpose of, I mean, particularly in COVID, we want to reduce the antenatal visits. So I practice at Cloudnine Hospital in Mumbai. I happen to be the medical director. We also have a separate app that Cloudnine has made, good app Cloudnine has made for teleconsultation. But having said that, I generally see to it that I call the person at least once a month, if not once in 15 days, for a physical examination. Or in addition, the consent which I have already shared with you gives me the required protection, so not to worry about it. But I take your point that physical consultation will always supersede online consultation. Then Prasuna has asked a question. We are running a staff of 30. I'm using methotrexate since tablet, methotrexate since 2 years. Now what to do? Can I open? No, sorry, I did not get this question. I think it is out of the scope of our current discussion. Do we need to prepare a separate tele-prescription? No, we answered this question. Can we prescribe? We answered. Can a patient who comes for treatment to a doctor or hospital and subsequently become a COVID positive sue the doctor? Okay, I think okay. So you are asking questions which are for my next webinar probably. Okay, so we will answer. Dr. Devashish Bhattacharya, hold on. I am going to answer that question in the next webinar. In fact, I think the other question, Prasuna madam, who has asked about opening the nursing home wala, I think that's also probably going to be dealt with in our next webinar. Okay, so people are, I think, preparing for the next webinar. That's what it looks like. Okay, over to Vinay. I think, no, sorry, there's one more new message. Let me check. Okay, fine. So I think we are more or less done with it, and I think over to Vinay for final comments.
So thank you very much, sir. It was indeed a great, insightful session, and I'm sure that based on the feedback which we are getting now, this has been much appreciated, and because of now the lifting of lockdown in many of the areas. I'm very grateful to you for taking time out of your busy schedule, and also we would like to thank all of our viewers. And once again, I would reiterate that the second part of this web series, or the webinar series, I would say, that would be on 8th of May. So please connect with us on 8th of May for further medico-legal aspects, especially in the gynecology stream. With this, thank you very much. Would also like to actually thank our the business unit head of Lupin, Mr. Vishal Meswani, and he is the one of the minds who was behind this particular topic, since he saw that many things are changing due to this COVID era, and I'm sure that we will be again connecting with our viewers with such kind of educational activities. Thank you very much.
Thank you.